Abdomen swelling and fullness symptom evaluation. Abdominal bloating is a feeling of fullness or swelling and tightness in the abdomen tummy. It is usually due to excess gas or liquid. Generally, the feeling subsides once the gas passes out. Another term called abdominal distension too means swelling of the abdomen. But there is an actual increase in abdominal girth when measured. Abdominal swelling is used as a description for both bloating or distension. However, swelling may not reduce if it is due to a benign or malignant tumor inside the abdomen. What are the causes of abdominal bloating, distension or swelling? Abdominal bloating, distension or swelling can be due to functional gestation disorders, where there is a problem in the function of the digestive tract. Organic gastrointestinal disorders, where there is a structural problem in the digestive tract, or non-gastrointestinal disease, where the problem arises outside the digestive tract. Some of the causes of abdominal bloating are listed below. Diet. Certain food like broccoli, beans, onions, cabbage, cauliflower, Brussels sprouts, lettuce, apples, pears, peaches, milk, pulses, chewing gum, carbonated drinks and whole grain foods can cause bloating. The patient may give a history of excessive intake of these foods. The bloating reduces if the specific food causing it is avoided. Lactose intolerance. Lactose intolerance is the inability to digest lactose, a sugar present in milk and its products. It occurs when the small intestines fail to produce enough amounts of lactase, an enzyme which digests the lactose. The symptoms in lactose intolerance include bloating, pain and cramps in the belly, vomiting and diarrhea following intake of milk and milk products. Avoiding lactose-containing foods is recommended to prevent discomfort. Intestinal obstruction. Intestinal obstruction is a condition where there is a blockage in the lumen of the intestines which prevents the flow of the intestinal contents. Causes of intestinal obstruction include roundworms, severe constipation, colon cancer and intussusception where one part of the intestine telescopes into another. The patient may present with pain in the abdomen, constipation, vomiting, abdominal distension and bloating. Intestinal obstruction has to be managed immediately to prevent complications. Gastroparesis. Gastroparesis is a disorder where the movement of the food is slowed down or stopped from the stomach to the intestine. It occurs due to damage to the vagus nerve that supplies to stomach muscle and causes it to contract. Diabetes neuropathy affecting the vagus nerve is a common cause of gastroparesis. Bloating is present in these patients. Chronic constipation. In patients with chronic constipation, bloating may be present due to the retention of stools in the large intestine, which gets fermented by bacteria to release gas. The patient usually gives a history of constipation.